Hey guys, welcome back to Burst TV. My name is Chris Michelle. I am a registered dental hygienist and a senior Burst ambassador. And today we're going to talk about bad dental habits that maybe as a clinician you've seen in the op, or maybe as a patient you've actually experienced these things yourself, and what solutions are going to help combat these type of habits. So let's get to it. So there are so many dental habits that I just could not fit in this video today. So stay tuned for more. And I had to reel in all my fellow Burst ambassadors who happen to also be registered dental hygienists and assistants and even dentists. And I needed their input to help me figure out what type of experiences that they themselves have actually been involved in, and how they were able to advise certain tips and tricks to their patients or even for themselves. So I got 5 to share with you guys today. So the first one is something I've actually experienced recently. I'm a new mom. So during my entire pregnancy, I was so nauseated. I'm sure there are a few moms out there that can relate. I was completely nauseated. There was nothing that could hold my cravings or appetite down except for chewing ice. I was chewing ice like crazy, and it didn't even recall to me that chewing ice links to anemia. So if you're not familiar with anemia or people who are anemic, it just means that there aren't enough healthy red blood cells. There isn't enough oxygen being distributed throughout the entire body. So your body's weak. And so you're low on iron, and I had to be prescribed iron supplements. So that is one thing that if you feel like you're chewing ice a lot, look into finding some iron supplements. You can find some natural supplements on Amazon. You can find them at the store. Maybe ask your physician if they have any recommendations. Maybe check your diet. Maybe you're not eating enough iron-enriched foods. Maybe there's something that you can change to kind of help you, avoid from chewing ice. And it's okay, chewing ice occasionally, but chewing it consistently can cause a lot of dental problems. It can weaken your enamel. It can make your teeth just extremely sensitive. It can make them very vulnerable and eventually just thin it out. So just kind of be aware if you're an ice chewer. Just kind of figure out maybe you should talk to your doctor, see if there's something else going on with your body that you can change up. So the second one is clenching teeth. And I feel like this is very, very common now that we're all wearing masks, and some people aren't used to it, so they tend to kind of be tense up. So basically your teeth are being pressed, the top and your bottom teeth are being pressed very firmly, and doing that constantly is either going to cause some wear on your teeth. You'll notice that there's some cupping going on. I'll link a picture right here. That's what that looks like. Or you might even have like TMJ issues with just the constant clenching, possible grinding. So this is a very common thing. I see a lot in the op. Sometimes night guards are prescribed or are discussed with our patients. So just getting fitted for the right night guard. But another tip a Burst ambassador had recently posted was that what she recommends to her patients is protruding your tongue enough to rest on your lower teeth, and and then just try to relax. So protruding your tongue enough on your lower teeth and relaxing, just kind of relaxing, and that kind of keeps you from clenching or biting or grinding, whatever it is. So if you are a person who is clenching lately or grinding, talk to your dental professional. See if they have any tips. See if maybe if you're clenching hard enough and it's becoming very severe, maybe look into a night guard. Maybe ask your dental provider what type of guard works best for you. There's so many different types of appliances out there that may be more suitable for you. So another dental habit that I've learned, and I've actually seen it in my chair too, is people who chew on their hair and finding hair stuck in their gums. So I just learned that, it's not because people want to eat their hair. I mean, maybe it does taste good. I don't know. But the reason is because we are all born with something, some type of tool, some type of like habit where it helps us soothe. And for some people, when it comes to certain situations, like, when they're in some type of anxiety situation, they often chew on their hair, or it's helping them focus on something. And so that is their coping mechanism. That is their pacifier to a baby like situation. So when someone's chewing on their hair and you're starting to notice that it's in their gums, their gums will probably start to inflame and bleed. And so the best thing to advise to someone like that, or for yourself, is to floss as much as you can. Maybe look into like some type of water irrigator, like a water flosser. And if it is some type of like anxiety situation, figure out maybe there's another tool that you can use to help cope with certain situations where you're dealing with stressful moments in your life. A fourth dental habit, which if you're a patient and you just happen to look inside your mouth and you see that there's this white horizontal line that looks like this, it's not completely abnormal. It is completely common when we see patients in our chair with this particular skin, lesion going on. It's normal. It just means that sometimes you might be biting your cheek. But if you're constantly biting your cheek, that particular horizontal line will eventually be more pronounced, and all that fibrous tissue will eventually come together, and it kind of look like a skin tag. It may not hurt, but it could be quite annoying. And for patients that I've seen in my chair that have that, we usually either have my dentist, surgically remove it, or maybe refer out to a specialist that can surgically remove it, just to kind of remove that skin. Because what is happening there is most times if you just leave it alone, it will stay like it is. But if you're constantly biting on your cheek, that skin tag-like lesion will eventually enlarge over time. And ways to keep yourself from biting your cheek is maybe, sucking or chewing like sugar-free mints, preferably xylitol mints, xylitol gum, just so you can keep your teeth and gums doing something. And that will kind of help prevent you from chewing on your cheeks. So the last dental habit, which is probably the most common. So if you're a patient, you're probably tired of hearing your dental professionals say this over and over again. And if you're a dental professional, you'll probably feel like a record playing, just playing over and over again. But it is brushing too fast or brushing too hard, or both. I mean, they kind of come hand in hand. So of course, if you are brushing too hard, first things first, are you brushing with a soft toothbrush? We always recommend patients to brush with a soft toothbrush. Why? Because just because a toothbrush is hard does not mean it's going to be more effective. You're just making your teeth and your gums even more vulnerable than they already are. So if you got a hard bristle toothbrush, throw that away, okay? Throw it away. Go get yourself a soft toothbrush. Also, if your toothbrush looks like this, throw your toothbrush away. That definitely means you are brushing way too hard. There's no way your toothbrush bristles should be fraying out. You want your bristles to basically look like this. Even when it's time to change the head, you still want them to look somewhat together. You know, if you are a hard, aggressive brusher, and you happen to be brushing too fast, and that happens, you know, when we're out and about and we gotta be somewhere, we usually brush for a few seconds. The recommended time to brush your teeth is for 2 minutes, and you can either set your timer on your phone for 2 minutes. I have kids in the op. I also saw a lot of birth ambassadors mention that they tell their kids to maybe play a song, maybe play a video for about 2 to 3 minutes long. So that way they're still engaged and they're still brushing their teeth for that appropriate time. And also, there's a lot of tools that have 2 minute timer embedded in them. Like, hello, this. So this is amazing. So if you can get somebody to maybe consider an electric toothbrush or something that's going to help them, just brush a little bit longer. And then another tip to hard, aggressive brushers or people who brush too fast is brushing in the mirror. The best way to see if you're actually taking off the plaque effectively is actually looking in a mirror. You'd be amazed how much plaque you can see as it's just flying off. So that's a really good motivator. Maybe try one of those habits and see if that helps. Thank you guys for watching this segment. If you have a bad dental habit that you came across with a patient or yourself, please drop it down in the comment box. Tell us your experience. Tell us what tips and tricks worked out for them or for yourself. Or if you have any more tips or tricks on any of the dental habits that we discussed today, please let us know in the comment below. Stay tuned for more Burst TV.